Welcome, dear friends. It is a joy to be here with you today, sharing knowledge that truly matters for those in their golden years. We are going to talk about back pain in older adults. Back pain is not just a physical discomfort. It can shape the way we move, the way we sleep, and even the way we feel about life itself. Think about those mornings when you wake up with stiffness in your lower back. When a simple act like bending down to pick up a book or standing at the kitchen counter becomes a challenge. These are not just minor annoyances. For many seniors, back pain is a daily reality that limits independence, reduces quality of life, and sometimes makes them feel dependent on others. Back pain is incredibly common. According to the World Health Organization in 2020, nearly 80% of adults worldwide will experience back pain at some point in their lives. In the United States, surveys from the Centers for Disease Control and Prevention in 2022 showed that older adults report chronic back pain at significantly higher rates than younger groups. That means back pain is not just a passing issue. It is one of the most frequent reasons seniors seek medical care and one of the main causes of limited mobility in later life. But here is the encouraging truth. Science has already given us clear answers. By understanding the causes of back pain and applying proven strategies, we can reduce its impact and even prevent it from worsening. Let us first look at why back pain happens so often in older adults. Aging naturally changes the spine. The discs between the vertebrae, which act like cushions, lose water and elasticity over time. This makes them less effective in absorbing shocks and increases the risk of pain and stiffness. The small joints along the spine, called facet joints, can wear down. This leads to friction, inflammation, and discomfort that shows up most often as lower back pain. Another key factor is osteoporosis. As bones become thinner and weaker, the vertebrae may collapse or fracture with very little force. The National Institutes of Health in 2020 reported that about 1/3 of women and 1/5 of men over the age of 65 have low bone density that puts them at higher risk of spinal fractures. These fractures often cause sudden and severe pain, but they can also create long-lasting discomfort. We must also consider the role of muscles. Strong core muscles in the abdomen, hips, and back are essential to support the spine. Yet as we age, muscle mass naturally declines. This process, called sarcopenia, leaves the spine less protected. A study from Harvard Medical School in 2019 confirmed that seniors who sit for more than 6 hours a day and do not engage in regular movement are far more likely to report chronic back pain. Lifestyle habits play a big role as well. Poor posture when sitting or standing, lifting objects incorrectly, or sleeping in unsupported positions can all place unnecessary strain on the spine. Over time, these small daily habits add up and create persistent pain. The American College of Rheumatology has pointed out that poor posture is one of the most overlooked contributors to spinal stress in seniors. Inflammation is another important piece of the puzzle. Diets high in processed foods, refined sugar, and saturated fats can increase inflammation throughout the body. This systemic inflammation makes nerve endings more sensitive to pain and intensifies discomfort in the back. Research on anti-inflammatory diets, such as the Mediterranean diet, shows that shifting to healthier foods can reduce inflammation markers and bring noticeable improvements in chronic pain within just a few months. Together, these factors, structural changes in the spine, weaker bones, loss of muscle strength, poor posture, and chronic inflammation, form the perfect storm that explains why back pain is so common in seniors. Recognizing the signs early is important. Common symptoms include dull or sharp pain in the lower back, stiffness that makes bending difficult, pain radiating into the hips or legs, or a feeling of tightness that does not go away after rest. If these symptoms last more than a few days or if they worsen with time, it is wise to seek medical advice. And if back pain is accompanied by warning signs such as fever, unexplained weight loss, sudden weakness in the legs, or loss of bladder or bowel control, immediate medical care is needed. The message is simple. Back pain is widespread, but it is not something to ignore. Understanding the underlying causes gives us power. And with that knowledge, we are ready to move to the next stage, exploring solutions that are not only safe but backed by solid science. Part 2. Causes, warning signs, and scientific evidence. Now that we have set the stage, let us go deeper into the main causes of back pain in seniors and examine what science tells us about them. The first major cause is degenerative disc disease. As the cushioning discs in the spine lose hydration and elasticity with age, they become thinner and less effective at absorbing shocks. This leads to stiffness, restricted movement, and in some cases nerve compression that radiates pain into the hips or legs. A large review from the Cochrane Library in 2021 highlighted degenerative disc disease as one of the most common structural changes behind chronic lower back pain. The second cause is osteoporosis and vertebral compression fractures. When bones become fragile, even small stresses such as bending over or coughing can cause a fracture in the spine. The National Institutes of Health reported in 2020 that 1/3 of women and 1/5 of men over age 65 are affected by osteoporosis. These fractures may present as sudden, sharp pain or as persistent aching that worsens with standing and walking. Left untreated, they can lead to curvature of the spine and long-term disability. The third cause is sarcopenia, or age-related loss of muscle mass. Strong abdominal and back muscles form a natural brace for the spine. Without them, the vertebrae bear more pressure than they should. A 2019 study from Harvard Medical School found that older adults with lower levels of muscle strength were significantly more likely to report daily back pain. Weak muscles mean less stability, less balance, and a higher risk of falls, which in turn may cause additional injury. The fourth cause is lifestyle. Long periods of sitting, poor posture, or lifting objects incorrectly can add strain to the back over years. A survey by the American College of Rheumatology showed that improper posture is one of the leading contributors to spinal discomfort among older adults. Sitting slouched, sleeping on mattresses that lack support, or twisting the spine suddenly when carrying weight all add up to chronic discomfort. The fifth cause is systemic inflammation. Chronic inflammation is like a hidden fire in the body. Diets rich in processed foods, red meat, refined sugar, and unhealthy fats fuel this fire. Inflammation makes the nervous system more sensitive and lowers the pain threshold. In contrast, diets rich in leafy greens, fruits, whole grains, nuts, and fatty fish reduce inflammatory markers in the blood. Harvard Health Publishing in 2021 noted that people following an anti-inflammatory diet reported up to a 25% reduction in chronic back pain after 3 months. While these causes are common, back pain is not the same for everyone. Some seniors feel a dull ache after long walks, others feel sharp pain when standing up, and others experience radiating pain down the leg, known as sciatica. Recognizing the pattern of pain can help in finding the right solution. It is also crucial to pay attention to red flag symptoms that signal the need for immediate medical care. These include sudden severe pain after a fall or minor movement, unexplained weight loss, persistent fever with back pain, progressive weakness or numbness in the legs, or loss of bladder or bowel control. The American Academy of Orthopedic Surgeons advises that these warning signs should never be ignored. They may indicate infections, tumors, or serious nerve compression that require urgent treatment. Research confirms that exercise is one of the most effective non-drug treatments for chronic back pain. A systematic review in the Cochrane database in 2020 concluded that structured exercise programs led to meaningful improvements in both pain and function in people with chronic lower back pain. Gentle strengthening and stretching exercises performed consistently were shown to be more effective than rest or passive treatments. Another body of evidence points to the benefits of physical therapy. Guided sessions with a licensed therapist can teach seniors the safest ways to move, sit, and exercise. According to the American Geriatrics Society, physical therapy can reduce disability and improve independence in older adults with back pain. Medication can play a role, but it requires caution. Over-the-counter options like acetaminophen or non-steroidal anti-inflammatory drugs may provide temporary relief, but they can also interact with other medications and may carry risks for the stomach, kidneys, or heart. Mayo Clinic emphasizes that older adults should consult a doctor before beginning any medication regimen for chronic pain. Finally, stress and mental health cannot be overlooked. Chronic stress tightens muscles and amplifies pain perception. Mind-body practices such as meditation, deep breathing, and gentle yoga have been studied for their benefits. A 2020 study in the Journal of Pain Research found that seniors practicing mindfulness-based stress reduction reported lower pain intensity and greater quality of life. When we put all this evidence together, the picture becomes clear. Back pain in seniors is not caused by one single factor. It is the result of aging structures, fragile bones, weaker muscles, daily habits, inflammation, and even stress. Each of these can be addressed, and each improvement, no matter how small, adds up to a better quality of life. With this understanding, we are ready to explore the practical steps that seniors can take at home. In the next section, we will discuss an 8-week action plan, specific exercises that strengthen the spine safely, and nutritional strategies that calm inflammation. These are solutions backed by science and tailored to the needs of older adults. Part 3. Practical Solutions and Conclusion. Now that we have a clear understanding of the causes of back pain in seniors, let us turn to the practical steps that can bring relief and improve daily life. These solutions are simple, safe, and supported by science. The first solution is exercise. Movement is medicine for the spine. Gentle, consistent activity strengthens muscles, improves flexibility, and reduces stiffness. Walking is one of the best choices for older adults. A brisk but comfortable pace for 20 minutes each day can increase circulation, release natural pain-relieving chemicals in the body, and keep the joints mobile. Swimming and water aerobics are also excellent because water supports the body and reduces stress on the spine while still giving the muscles a good workout. Specific strengthening and stretching exercises can also be done at home without equipment. One simple exercise is the pelvic tilt. Lie on your back with your knees bent and feet on the floor. Gently tighten the stomach muscles and press the lower back toward the floor. Hold for 5 seconds and release. Repeat 8 to 10 times. This strengthens the core muscles and reduces pressure on the spine. Another useful exercise is the knee-to-chest stretch. Lie on your back, bring one knee toward your chest, hold for 20 to 30 seconds, then switch legs. This stretches the lower back and relieves tension. The bird dog exercise, performed on hands and knees by extending opposite arm and leg, improves balance and stability. Glute bridges, where you lift your hips from the floor while keeping shoulders grounded, strengthen the lower back and hips. Each of these movements, practiced slowly and safely, adds resilience to the spine. The second solution is physical therapy. Guided sessions with a trained therapist provide personalized instruction on posture, balance, and safe lifting techniques. According to the American Geriatrics Society, physical therapy not only reduces pain, but also prevents future injuries by teaching seniors how to move correctly. The third solution is nutrition. What we eat affects the level of inflammation in the body. Diets that reduce inflammation are rich in vegetables, fruits, whole grains, nuts, olive oil, and fatty fish like salmon and sardines. Spices such as turmeric, ginger, and garlic have natural anti-inflammatory compounds. A day of meals might look like this: oatmeal with berries and ground flaxseed for breakfast, a salad with leafy greens and grilled salmon for lunch, a handful of almonds and an apple for a snack, and a lentil and vegetable stew for dinner. Harvard Health Publishing noted in 2021 that people who adopted such a diet experienced measurable reductions in chronic pain within 3 months. The fourth solution is posture and daily habits. Sitting in a supportive chair with a cushion for the lower back, keeping both feet flat on the floor and avoiding slouching can prevent unnecessary strain. When lifting objects, bend the knees, keep the back straight, and hold the object close to the body. Sleeping positions matter too. Lying on the back with a pillow under the knees or lying on the side with a pillow between the legs reduces stress on the lower spine. These small adjustments, practiced every day, make a significant difference over time. The fifth solution is stress management. Stress tightens muscles and amplifies pain signals. Simple practices such as deep breathing, meditation, or listening to calming music for 10 minutes a day can relax both the mind and body. A 2020 study in the Journal of Pain Research found that seniors who practiced mindfulness regularly reported lower levels of pain and greater satisfaction with life. Medication is sometimes necessary, but it should always be approached with care. Over-the-counter pain relievers can help in the short term, but they are not a long-term solution and may pose risks if used excessively. Consultation with a physician is essential, especially for older adults who often take multiple medications. Beyond these individual solutions, creating a safe home environment is also critical. Clearing walkways of clutter, adding supportive handrails, and ensuring proper lighting reduces the risk of falls that can worsen back pain. Regular checkups with healthcare providers help detect osteoporosis, spinal degeneration, or other issues early, before they progress to serious problems. Let us put these pieces together into a simple action plan. Over the course of 8 weeks, an older adult can begin with short daily walks and light stretching. Gradually add strengthening exercises, improve posture habits, shift toward an anti-inflammatory diet, and practice stress reduction techniques. By the end of 8 weeks, most seniors notice more flexibility, less stiffness, and improved confidence in daily activities. Back pain is a common challenge, but it does not have to define the later years of life. With knowledge, consistency, and the support of science, older adults can manage pain, protect their independence, and continue enjoying the things they love, whether it is gardening, walking with friends, or playing with grandchildren. In closing, remember this: back pain is not simply a consequence of aging that must be accepted. It is a condition that can be managed, relieved, and often prevented. Every small choice, a daily walk, a balanced meal, a corrected posture, a moment of relaxation, is a step toward freedom from pain. Thank you for taking the time to listen today. May your days be filled with strength, movement, and comfort. May your back support you as faithfully as you have supported those you love throughout your life. And may the years ahead be healthier, lighter, and brighter than ever before.